Interactions between dairy products and the gut were under discussion at the 2013 Experimental Biology Conference in Boston, and our natural ability to deal with lactose was the first highlight.
Lactose is a complicated sugar in milk. One of the great aspects about it is that it contains galactose, which is very important for brain development. But children switch off their lactase, which is the enzyme that breaks down lactose, when they are weaned from breast milk. And so as adults, if we are to continue to consume dairy products, we need to be able to continue this trick of having lactase in the intestine.
And that genetic trick is recent in human evolution, and only some populations have it.
In at least 4 different populations around the world, this gene has been selected for within about the last 200 to 300 generations of human evolution. And it's been selected for very strongly. So when this trick was first evolved, it's now spreading throughout the world. But it has not yet spread to China and the Far East. And so those populations, the evidence would suggest they would not be able to consume as much lactose as European populations, for instance, without having some gastrointestinal adverse events.
But Dennis Saviano reckons yogurt could be a solution for these lactose-intolerant patients.
Yogurt bacteria contain a high level of the lactase enzyme, and this enzyme actually acts in the intestine to help digest the lactose. And there are very well-controlled, double-blinded clinical trials that show that lactose-intolerant individuals can consume significant amounts of yogurt, in fact, as much yogurt as they want, and not have symptoms of intolerance.
But the benefits of yogurt could extend beyond nutrient intake and lactose intolerance thanks to fermentation.
It looks like that the fermented products such as yogurt and cheese seems to be more healthy than others. And it's probably due to some of the byproducts by the bugs in the bacteria in the yogurts and cheese, that they produce some different, maybe short-chain fatty acids and other products that have some health benefits. And it may vary from what kind of bacteria it is. Today we have recognized that all the billions of bacteria we have in the gut are extremely important for our health. So what bacteria we feed to our gut is probably quite important.
The good bacteria, or probiotics, could confer beneficial effects when they're ingredients of foods, such as dairy products.
They can reduce the number of pathogenic bacteria that could inhabit your gut, your intestine, or they can modulate your immune system. We have to keep in mind that in our intestine, in our gut, there are a lot of cells that are related to the immune function. And so if you have good bacteria, the probiotic bacteria, in your gut, it is more easy that they could modulate your immune system in order to obtain 2 final goals. One is to have a very active immune system against the infection. And the second one is just to reduce the risk of allergy. And especially, there are several studies showing a positive effect against atopic dermatitis and this kind of allergy.